So I've always wanted to be a doctor. I grew up in Los Angeles and I saw a lot of health disparities and health inequalities in the minority population. And I've always wanted to kind of work to get to a point where I can help people who are facing those inequalities.
I really can't imagine myself in any other career field. So there are hard days and there are long shifts, but I'm happy that I get to do something that I enjoy doing on a day-to-day basis.
This is my last year of training, and this is exactly what I was meant to do.
These past 2 months, and I don't know how long this is going to last for, is going to be a defining experience in our training. I think it's going to be something we'll look back at and think about how all of our colleagues were able to work together in dealing with something so unprecedented.
When I think about the times we're going through, there's a quote by Nelson Mandela that I kind of come back to. Courage is not the absence of fear, but the triumph from it. And it's always nice to remind myself during this time that even though we are afraid and we don't know, I think we'll overcome it together as a community and as a team.
So since COVID-19 has happened, I've been in the ICU pretty much exclusively.
The second you step foot into the hospital, a switch gets flipped on. You have one mission, one goal, and that is to take care of patients, and all your effort and ability goes into that one thing.
We're learning so much about the disease process every day, and we're constantly hearing updates about treatments that work and don't work. But ultimately, we're kind of on the ground floor, and anything we see based on our clinical exam could potentially be, a new finding, a new symptom of COVID.
I've seen patients recover drastically, from being literally on death's door where I don't know if I'm going to be able to get them through this, to talking and saying hello and leaving the ICU, 20 days later.
I did have recently a patient who we were able to take the breathing tube out. And a couple days later, I was in his room and he said, "So I remember you." And I said, "Oh, good." Because I could tell he was starting to get back a lot of his cognitive function. He said, "You were the doctor who came in and talked to me about needing that breathing tube." And he just expressed a lot of gratitude to the care team, to the whole team for taking care of him and being there to kind of get him through this situation.
When I get to discharge patients and I see them being wheeled out and getting to go home, it's so rewarding to be able to help people and know that we're actually getting them better and getting them home.
I am working hard, not just for the patients, but also for my colleagues, because we're all working in this together. We're all spending hours and hours and days in these ICUs. It's difficult, it's hard, but I got your back, you got my back, and we're going to protect and help each other no matter what.
Everybody's role is essential, and no one person can do their job without everybody else doing it perfectly, which they have been.
But I think probably the effects of it that are going to stay with me the longest are not necessarily the medical parts of it or the medical manifestations of it, but more this sense that when we want to accomplish something as a healthcare team, as a medical system, if we all work together and we all recognize the value and utility that each of us bring to the table, we're capable of so much.
I'm proud of everybody that was helping out, and I'm proud of the person that stayed at home. I'm proud of the person that donated food. I'm proud of the person that helped just their neighbors. I mean, I think it really shows how much we really care about each other. There's a lot more that brings us together than divides us, and I think we'll look back at this in those exact ways.